Sequencing of the genome has brought to light several mutations which are responsible for varied types of disease, including cancer. Next generation sequencing particularly has simplified and revolutionized the process of sequencing and made this easily accessible to patients and clinicians. Targeting these mutations with specific treatments for individual genomic variations has led to the customized treatment of personalized medicine for patients and what is known more as precision oncology. So this has increased opportunity for treatment of our patients. Unfortunately, Africa has trailed behind. There's been a lot of progress with respect to management of cancer patients and even some use of targeted therapy on the African continent. However, there's still lack of knowledge and also in most cases, financial constraints and availability of the adequate logistics to be able to make this really a part of cancer management in Africa. And another thing is that there's also lack of well-developed cancer registries in most countries in Africa. Some are building them up. There are some countries who have population cancer registries and very few who have established cancer registries. So these are all limitations, significant limitations into the improvement of genomic research in Africa. Genomics is also being studied in some parts of Africa, but there's still a dearth of knowledge and data that have to be realized. Yes, so the Special Virtual Genomics Conference sought to develop a network of scientists who can lead genomic science in Africa, and also to develop a special interest group on genomics in AORTIC, and then to develop a research agenda for Africa. And there was an overarching goal of cancer genomics research in Africa to develop an African cancer genomic atlas eventually. So these were the major goals that we were looking at. Highlights of the genomic conference. I'll start first of all, talking about the fact that we had a 3-day conference. Day 1 and 2 were the actual conference where we had a number of speakers and keynote speakers from Africa, the diaspora, and the US Friends of Africa who spoke on various aspects of genomics. We also had a day 3 aspect of the conference, which was by invitation only. And in that, we actually looked at specific goals and objectives that we wanted to come out with, looking at the whole conference goal. So for day 1, we had a number of speakers. In fact, first of all, we had some remarks by a welcome address. I gave the welcome address as a chair. And then we had another welcome address by the AORTIC president, Dr. Bello. And we also had another welcome, more or less, address by Dr. Folakemi, Professor Folakemi Odedina, and she is the AORTIC Research Committee chairperson. So I just wanted to say something important about the AORTIC Research Committee because the genomics planning was actually a baby, more or less, of the Research Committee of AORTIC. And the Research Committee of AORTIC has 5 specific groups. The one group that looks at research agenda, the second group looks at research funding, the third group is into research infrastructure and collaborations. And the fourth group is on dissemination of African cancer research. And that is the group under which the Genomics Planning Committee sort of was formed. So that group seeks to actually, through scientific conferences, peer-reviewed journals, and traditional media, social media, propagate work that is being done in Africa. And one of the things we had wanted to look at was some special virtual conferences, which included genomics. So that is the first we have actually come up with. And then the 5th group under the AORTIC Research Committee is a special interest groups. We have these in AORTIC, and we are able to subdivide people under their specialties into various groups to help also promote research. So the main aspect of the conference, we had a number of speakers, and our speakers started with Dr. Solomon Rotimi, who is the AORTIC Research Committee co-chair. And he also spoke about who an African is, the specific genetic traits in Africa, the variants we have in Africa, some clinical trials that have been done in Africa to actually follow the genomics and variations in hereditary, in Africa, more or less variations in Africa. So he spoke about that. Then we had Dr. John Captain in the US, who followed up with some talk about various aspects of cancers, various cancers. He looked at breast cancer, colorectal cancer, prostate cancer, and research that have been done in these specific areas as well. And he also specifically discussed the developments in racial disparity in studies that have been done in different types of cancers, suggesting that uncovering health disparity related factors provides more depth in understanding the disease etiology. So this was the key highlight of his talk. Then this was followed by a talk by Dr. Pedro Fernandez, who actually looked at the importance of ethics in genomics. So he focused on the importance of research ethics and the fair selection of study populations and favorable risk-benefit issues and importance of independent reviews as well. He also was followed by Dr. Melissa Davis, who also looked at the effective management of genomic data, which is absolutely important. And especially when you're trying to do trials in Africa, you have to be very cautious about the genomic data management, because people are very skeptical about releasing, information on genomics, genetics, even culturally. Some things are really not accepted by the African people as at now. So genomic data and how it's handled and all is very important. Professor Kosje Yamwa also ended day one by talking about the utilization of oncology care with a focus on precision medicine. Then we had some oral abstract presentations which were pre-recorded. We listened to them, and then there was a summary by Dr. Peter Kingham and Dr. Melissa Davis. So for day two, we also had a number of presentations. Professor Lisa Newman, who is a breast cancer specialist, also spoke about breast cancer and the various variations that we have in breast cancer, the global distribution, the burden of the African American patient who has breast cancer, socioeconomic disparities and all. This was followed by a talk by Professor Timothy Rebeck, who spoke about prostate cancer and what the MADCAP is doing. That is the men of African descent who have prostate cancer, what work they are doing in Africa as well. He also spoke about the epidemiology and that Africa is a hotspot for prostate cancer mortality. And even if you look at the African Americans and in relation to prostate cancer, there's greater than 80% incidence in African Americans with prostate cancer, and you have more than twice mortality in African Americans compared to the Caucasians. So that was what Professor Timothy Rebeck spoke about. Then we also had Professor Fumi Olopade, who also is a breast cancer, also does a lot of genetics in breast cancer. She also spoke about the evidence of heritability of cancer in Africa, breast cancer genetic studies that have been done in Nigeria, especially in sub-Saharan Black women versus the white Caucasian women, and also spoke about the benefits and risks of cancer genetic testing in Africa. Dr. Peter Kingham then spoke about colorectal cancer and some studies that have also been done in Nigeria with respect to that. Then we also had Dr. Julie Johnston, also from Florida. She spoke about pharmacogenomics in cancer and how genomics and genetics have to do with the management and the pharmacology of the management of these cancers. Finally, we had Dr. Howard McLeod, who is also from Florida in the US, and he also spoke about the importance of precision oncology in genomics and the management of patients. Then this was followed by the second round of oral abstract presentations. But the other important thing we did was a poster Twitter session, and that happened on the first day. So everyone who presented their posters actually had the posters on Twitter, and we had people following, and that created a lively kind of environment for research dissemination. So the basic thing about this conference has been that we wanted to disseminate what is known in Africa and so that we actually know what the status quo is and how we're going to move forward beyond that. Some of the plans that we came up with, and those were the things we looked at or we discussed at the day 3 of the conference. Some of them were to overcome the limitations that we have, to organize more local regional conferences to help integrate researchers in Africa who are interested in genomics with each other, and also with our colleagues and friends in the US who have already done a lot of research in genomics. We also wanted to institutionalize and strengthen what we call the special interest groups, like I mentioned before, in genomics, by reaching out to researchers around the world who are willing to join and then help improve on these collaborations, also to build capacity and possibly to commercialize cancer research as well. So these were some of the things we looked out for. And then we also wanted to look at genetic diagnostics, because of the cultural, socio-cultural aspect of our African kind of ethnicity and all. We needed to look at how we could improve on genetic diagnosis and genetic counseling in our African countries, how we can integrate that into our teaching institutions, so that people understand a lot more about it. People are trained in genetic counseling, our patients understand it, provide, possibility for patients to have, genetic counseling and also genetic diagnosis for whatever, especially for cancer patients. So they really understand, for the proband and also for family members of cancer patients. We realize that it's very important to ensure that whoever is counseling these people really understand what it is about, because there are a lot of, legal issues, especially in the area of genetics, so that we can really get a hang on that, and also through that improve the management of cancers with respect to targeted therapy that is available for patients who have specific mutations. And then we also proposed an R13 grant, which we are working on with some colleagues in the US. And in that, we're trying to work on a program outline, possible funding for that, so that at the next AORTIC conference in 2021, in November 2021, Dakar, Senegal, hopefully we'll maybe have a hybrid conference where we have an conference and also a virtual one where people can have actual, lectures on genomics. So this will be an extension of what we've done currently, and also at that time bring together other people who are interested in genomics to actually come on board, so that this special interest group in genomics we have formed will be able to move forward with, to do greater things in Africa. Well, I'd like to say that, this is a premier virtual conference that we have organized in Africa. I think it is one conference that has brought together, a lot of people with interest in genomics. We had so many people attending the conference, and it's brought to light what has been done in Africa, because people had been doing various researches in parts of Africa, in collaboration with colleagues outside Africa. But it wasn't really a collaborative kind of thing. So it was in isolated cases, but now we actually know what is being done. And from there, I think there's a lot of prospect for development on the continent. And all roads lead to Africa. So as Dr. Rotimi said, all roads, and as Professor Odedina also said, all roads lead to Africa. So really, it is now the fact that there are a lot of racial and disparities, there are a lot of genetic variations and all in the African continent. There's still a lot that we can learn from doing research in Africa. So we know what the genetic diversities are and racial disparities in various ways, so we can help to improve genomics in this continent, and also things that haven't been known in the area of genomics and genetics can be known from research in Africa. So I think this is a very exciting development. The time it's very right. And I hope that we'll be able to move forward to also be able to sequence the African genome. I think that would be the greatest thing that we could do. Thank you.